Lidocain. What is this drug lidocain? The suffix cain indicates this drug acts as local anesthetic. This lidocain can also be called with another name lignocaine, and it is well known by the brand name xylocaine. All these are the synonyms for lidocaine, and this lidocaine is a amide type local anesthetic. Local anesthetics are of two types, either amide derivatives or ester derivatives. So lidocaine is a amide derivative. Because of amide linkage, this drug is more stable as well as less allergic compared with the ester derivatives. But at the same time, this drug is having more systemic toxicity. Let us see how this drug acts. Lidocaine acts as local anesthetic by inhibiting the neuronal transmission through the axon. Particularly, it blocks the voltage-gated sodium channels, thereby it inhibits axonal conduction. So on the axon, sodium channels can exist in three states. They can exist as closed state, where they are not allowing the sodium ions. Otherwise, they can exist as open state, where the gating mechanism is open so that sodium can enter through this channel. Otherwise, they can present as refractory state, where the inner gating mechanism is somewhat closed. So it is in the intermediate state between open as well as closed states. Now the sodium ions can enter through this open state sodium channels so that they can produce depolarization of the axon, which produce the neuronal transmission. Here lidocaine can block this neuronal transmission. Now lidocaine can block the open state ion channels. So it can block directly the open state ion channels, and this type of pathway is called hydrophilic pathway. Otherwise, the lidocaine can cross the lipophilic membrane and it can enter into the cytoplasm. Now within the cytoplasm, this drug is going to be protonated so that it is hydrophilic in nature. Now it can block the inner side of this open state sodium channels. So this type of pathway is called hydrophobic pathway. In this way, lidocaine can act by both hydrophilic as well as hydrophobic pathway. And by both of these pathways, lidocaine can inhibit the sodium channel activity, resulting in the decreased neuronal conduction. What are the precautions? One of the important precautions of lidocaine is that this drug can produce some local reactions. So when this lidocaine is going to be applied on the skin or mucous membrane, it can produce some irritation, burning sensation, some bruising, edema as well as erythema can be observed. That's why this drug should be used at a low dose for topical purpose in order to minimize the local reactions. Similarly, this drug can produce methemoglobinemia. Particularly, this condition is observed in the patients who are having glucose 6-phosphate dehydrogenase deficiency. Glucose 6-phosphate dehydrogenase is one of the important enzymes required for production of NADPH. This NADPH can activate the glutathione system so that it can reduce the oxidative stress. So in the patients with decreased levels of glucose 6-phosphate dehydrogenase, the oxidative stress is increased, resulting in the destruction of RBC cells. So this damage to the RBC may result in the decreased oxygen carrying capacity, resulting in few of the symptoms such as blue discoloration, seizures and arrhythmias can be produced. That's why this drug should be carefully given the patients who are having the risk of methemoglobinemia. In such patients, this drug should be carefully given. Effects. The important side effects of lidocaine are mainly related with its local action. It can produce some local irritation, erythema, flushing, redness of the skin, pruritus, edema can be produced, and it can also affect the CNS, resulting in nervousness, lightheadedness, tinnitus, some buzzing noise in the ear, blurred vision, bradycardia, any hypersensitive reactions like angioedema, and hypotension can be observed with this lidocaine. How it is given? Lidocaine is available in different dosage forms. It is available as solution, cream, gel, even spray, patches. In all these dosage forms, it is available. Even it is available as powder. And in many of the formulations, it is combined with other drugs such as epinephrine. Otherwise, it is combined with other drugs such as metronidazole to produce anesthesia in the oral cavity. But as a solution, this drug is given by IV route to produce the epidural anesthesia, perineural anesthesia, percutaneous anesthesia. And in other dosage forms, it is given by topical route to produce local anesthesia.